70 years ago, in the heart of Cape Town's northern suburbs, Stellenbosch University brought about a vision to create a place where the advancement of human health became the foundation on which teaching and learning in service of society was built. Ever since, the Faculty of Medicine and Health Sciences, based at Stellenbosch University's Tygerberg Campus, has continued to grow, evolve and inspire healthcare leaders both in South Africa, on the African continent and worldwide.
In 1956, the Faculty of Medicine and Health Sciences at Stellenbosch University opened its doors at the Karl Bremer Hospital premises with a mission to train healthcare professionals for a growing population in the Western Cape. 20 years later, the faculty and the Tygerberg Hospital opened their doors to students and patients respectively, and that mission has become a legacy of teaching and research in the service of the South African communities.
Transforming from a centre serving only one South African demographic, since its establishment, the Faculty of Medicine and Health Sciences has evolved into a diverse and vibrant educational space, moulding and shaping leaders in the creation and translation of medicine and health sciences knowledge, leading to improved health and health equity, and co-creating value with and for the community it serves.
So baie studente het oor die afgelope 7 dekades deur ons deure gestap. Ons is trots daarop dat hulle grade baie meer as net akademiese toewyding bewys. By die fakulteit Geneeskunde en Gesondheidwetenskappe strek studente se leerervaring soveel verder as wat hulle leer uit handboeke en simulasielaboratoriums. Ons studente is geleer om te gee vir mense en in te alle tye die volle kompleksiteit van mense se lewenservaring en agtergrond te respekteer. Students in our 6 undergraduate programs are trained in a patient-centered approach to healthcare, which they take with them into South Africa's clinics, rural communities, and real lives. The faculty also offers over 90 postgraduate programs tailored to meet the healthcare needs of South Africa and the African continent. We follow a collaborative and future-focused approach to training, employing cutting-edge techniques and technology. We base our training on real societal needs to train healthcare workers and scientists that are equipped to function effectively in the real world and collaborate across disciplines to deliver full-rounded healthcare.
Teaching and learning in the health sciences has transformed rapidly, especially in the last 3 decades of our faculty's history. We were one of the first universities in South Africa to establish a unit dedicated to the scholarship of health professions education, and we are proud that we continue to lead this transformation. Our programs are continuously renewed to stay at the forefront of advances in health sciences. We are particularly proud of the reintroduction of our undergraduate nursing program in 2019 and the reimagined MBCHB curriculum that introduces clinical exposure from the first year of studies. This strengthens primary healthcare training, provides exposure to health systems, and prepare students to serve diverse communities with excellence.
To support our teaching endeavours, the faculty introduced new digital learning platforms, including the Medical Morphology Learning Centre, a collaborative tech-enabled space that supports modern, student-centred learning. It has also integrated augmented and virtual reality and simulation-based education into clinical training, giving students the opportunity to practice procedures and engage with complex medical scenarios in realistic virtual environments.
Our goal is not only to develop knowledgeable graduates, but also compassionate and agile healthcare professionals ready to meet the challenges of an ever-changing healthcare landscape.
The faculty's research focuses on solving real health problems driven by the health needs of our country and continent. From infectious diseases to non-communicable conditions, researchers here are at the forefront of discovering, questioning, and ultimately improving lives.
Our research spans a wide spectrum of diseases with a strong focus on the health challenges facing South Africa and the African continent. Our world-class researchers are leaders in areas such as tuberculosis and psychiatric research, and we have a strong scientific corps working on everything from HIV and emerging pathogens to diabetes, cancer, and maternal health. Our research has played a paramount role during the COVID-19 pandemic in understanding and tracking the disease. researchers in collaboration with others in the SADC region discovered both the Beta and Omicron variants of SARS-19, which served as an early warning system to alerting the world to the threats of evolving variants in real time. Our clinician scientists working on the front line of the pandemic continue to produce impactful research that enable evidence-based decision-making to save many lives. With cutting-edge laboratories in our state-of-the-art Biomedical Research Institute, interdisciplinary collaboration, and a deep commitment to community impact, our researchers are not only generating new knowledge, but also translating it into real-world solutions. Hulle vra die moeilike vrae, daag verouderde aannames uit en ontwikkel intervensies wat nie net innoverend is nie, maar toepaslik is op alle vlakke van die gesondheidsstelsel. Deur hul pogings word lewens verander, een studie, een deurbraak, een pasiënt op 'n slag.
The Faculty of Medicine and Health Sciences have a tangible impact on healthcare on all levels of society, from trailblazing research to informing health policy, guidelines and practice, to grassroots level care delivered right in communities.
Healthcare doesn't start in hospitals. It starts in communities, and so do we. Stellenbosch University has a proud tradition of engagement with civil society, community organizations, industry, and government. At the Faculty of Medicine and Health Sciences, our approach to social impact is shaped by strategies designed to have the most positive health outcomes on our communities. Through the immersion model of clinical training within the health services, both undergraduate and postgraduate students are able to serve while learning and learn through serving. Our staff and students provide patient care at hospitals and clinics, including in rural and underserved areas, and support the integration of clinical training, teaching, service, and research at all levels of care. Through fieldwork, clinical placements, internships, and service learning, our students help strengthen healthcare services across the Western Cape. Health is not a service. It is a relationship built on trust, respect, and shared knowledge. Through the course of the faculty's history, we have been able to achieve that with a great degree of success.
This faculty's journey has not been without the pain and exclusion inextricably linked to South Africa's past. We acknowledge that the original rationale for the establishment of this institution was for the education of white South African, Afrikaans-speaking male physicians. We also acknowledge that this exclusive approach deeply scarred parts of the surrounding communities when it was built. As part of our 70-year celebration, we want to recognize and give heartfelt thanks to the many individuals who, since the advent of democracy, began the vital work of rebuilding this faculty and indeed the institution as a whole. Their vision and dedication laid the foundation for a place that continues to grow and transform. While it is not yet perfect, our faculty is increasingly a place that reflects South Africa's rich diversity in culture, language, and experience. We can see this in our lecture halls, in our residences, our academic and professional staff cohort, and in the many endeavors we've undertaken over time to create a more inclusive and compassionate place of learning.
As Senior Director Business Management, I have had the privilege of overseeing the growth of the Tygerberg Campus complex for 2 out of its 7 decades. In that time, I witnessed how focusing on students and staff and diversifying this faculty's income ultimately became 2 of our biggest strengths. 20 years ago, most of our funding came from government allocations and student fees. Today, less than half of our income comes from those traditional sources as we've expanded to include research grants, philanthropy, commercial activities, and technology transfers. This shift has been critical, securing our growth and sustainability. Over time, the faculty's research outputs have increased, student numbers have grown, and we've developed world-class facilities like the Biomedical Research Institute, which is the largest of its kind in the Southern Hemisphere. Die fakulteit is niks sonder sy mense nie. Dit is die personeel hier wat dit alles moontlik maak. Oor die jare het ons talle verhoudings gebou met 'n gedeelde visie om hierdie 'n meer inklusiewe plek te maak vir ons toekomstige gesondheidswerkers. Ek is trots op wat ons die afgelope 70 jaar vermag het. Ons is sterk, dinamies en gereed vir 'n fantastiese nuwe toekoms.